Good morning. My name is Dr. Jen Jacoby, and I have the pleasure of serving as Director for the Institute of Healthy Living and Chronic Disease Prevention. Welcome to this morning's webinar. Before we begin, I would like to respectfully acknowledge that UBC Okanagan and the North Okanagan Hospice Society is situated on the traditional, ancestral, unceded territory of the Syilx Okanagan Nation. I would also like to acknowledge that today there are many joining us from many places near and far, and acknowledge the traditional owners and caretakers of those lands. Welcome to the 11th annual Okanagan Embrace Aging Month, and thank you for joining us. Embrace Aging is co-hosted by the Institute of Healthy Living and Chronic Disease Prevention here at UBC Okanagan, Interior Savings, and the Interior Health Authority. Thank you for our partners. UBC Okanagan recently joined the global network of age-friendly universities. What this means is we have a formal pledge to make UBCO more accessible, intergenerational, and committed to research programs and knowledge translation that are informed by the needs of an aging society. If you want to know more about the Age-Friendly University Initiative here at UBC Okanagan, or have suggestions for us on how to become more involved in the community, or if you would like to get involved in our activities, please contact us through the Aging in Place Research Cluster and the website at aginginplace.ok.ubc.ca. Now, on today's event. Embrace Aging Month was launched 11 years ago to celebrate and raise awareness about positive aging, and has once again this year culminated in a number of events organized both in person and online to create educational opportunities and activities through the month of March. The sessions are designed for everyone, young and old alike. But we always focus on healthy aging and ways to improve quality of life among older adults and their family and caregivers. There's a variety of topics that we discuss and try to reach out to the public through events. Our goal is to inspire everyone to embrace positive aging. Thank you for joining us in today's event. Now, a few process items for the next hour with respect to this webinar. There will be a closed captioning box on your screen, potentially, or maybe not. But if the closed captioning box appears and it's in your way, you can drag it or move it to your preferred location just by clicking on it and moving your mouse or the little box around your keyboard. Also, if you don't like the closed captioning box, select the Hide Captions button on the menu bar and it will disappear for you. During today's event, if you have questions or comments, please place them in the chat box during the presentation, and they'll be read after the event, after the presentation, during the Q&A session. Now, today's event is a Research to Practice webinar, and it is co-hosted by the Institute for Healthy Living and Chronic Disease Prevention with our partner, the North Okanagan Hospice Society. And with that, it is my great pleasure to introduce Claire Dick, who is the Education and Research Leader for the North Okanagan Hospice Society. Clara?
Thanks, Jennifer. Yeah, it's a great pleasure to be here, especially during this Embrace Aging Month. What a great topic. And so this topic is near and dear to my heart. We've had Nav-CARE at our hospice for 5+ years, so I'm excited to see this new iteration. But anyways, I'll just introduce Madison. So it's my pleasure to introduce Madison Smith, a PhD candidate with the School of Nursing, Faculty of Health and Social Development at UBC Okanagan. She will be presenting on adapting Nav-CARE to support caregivers of people living with dementia, findings from a pilot study. So Madison, I am going to turn it over to you.
Great, thank you. And thanks everyone for attending the webinar today. I'm going to be discussing my PhD research that I'm in the process of finishing now, and it's really been focused on adapting Nav-CARE, which is a navigation program that utilizes trained volunteers. And in this version of the program, those volunteers support caregivers of people living with dementia. If you attended my first webinar I presented at about a year ago, I discussed the first phase of this project and some of the preliminary findings from the pilot. But now that the pilot's been completed and I'm in the writing stages of the research, I have some more concrete findings to discuss today. So I know everyone didn't attend the first webinar, so I'll still go through the first phase a little bit, but just in the details that we need for the rest to make sense. So hopefully it makes sense for everyone, and I won't bore everyone to tears with if you attended the first webinar. So yeah. So I'll go over a few different components of my research to outline the process of how we've worked on adapting the existing Nav-CARE program to fit the dementia context. So I'll provide a bit of information on the Nav-CARE program and what that actually is. Then I'll go through the different steps of the research, which are the literature review, the curriculum development, and the pilot study. Then I'll go over the findings from the pilot study and what the key takeaways are from this entire process, and then what the next steps will be for making some changes to the program, different knowledge translation strategies, and future implementation. So what exactly is Nav-CARE? So the name stands for navigation, connecting, accessing, resourcing, and engaging. And it's a volunteer navigation program that's been implemented in multiple sites across Canada within hospices and other organizations. And essentially it utilizes trained volunteers to support people with life-limiting illnesses that are living in the community. And that's to help them navigate different components of the disease, which might look like planning for healthcare appointments, finding resources in their community, dealing with sadness, and really anything that might come up with the disease. So the hope is that through consistent visits with a volunteer, the client will be supported to engage with their community and access resources, as well as have someone to confide in. Now, the program wasn't developed specifically to support caregivers of people living with dementia, and there are a lot of different components that need to be considered when the support is being provided to the caregiver directly rather than the person living with the life-limiting illness. And also, dementia itself presents some unique nuances about care that aren't necessarily present in other illnesses, and so we really need to consider that in adapting the program. So the goal of this research really has been to figure out how we can adapt Nav-CARE to adequately support caregivers of people living with dementia, and if a volunteer navigation program that supports caregivers directly really works in this dementia context. So to adapt the program, it was split into 3 distinct steps that I've been working on over the last 4 years. So the first was conducting a literature review to understand caregivers' needs, existing programs to support them, and what dementia navigation programs have looked like so far. The second was to develop a volunteer training curriculum that would be used to train volunteer navigators. And the third was to pilot the program. And so I will go through each of these steps. So the first was the literature review, and I will just give a few highlights about key information that informed this research. And that was very much me for lots of months, just reading and reading. So who are caregivers? When we talk about caregivers in this context, these are caregivers who are not employees or being paid for the support they are providing. They're often spouses, friends, children, neighbors, and siblings of the people who are living with dementia. Their caregivers are a huge component of the care community, and they provide around 82 billion hours of care worldwide, which is equivalent to more than 40 million full-time workers. They're often in the caregiver role for about 6.5 years on average, and they're supporting people living with dementia with a variety of tasks from cooking, cleaning, personal hygiene, attending doctor's appointments, making healthcare decisions, and providing emotional support. As you can imagine, as our population continues to age, the amount of caregivers is anticipated to increase, and estimates suggest that in Canada alone, there will be 1 million caregivers by 2050. When we look at how they're doing compared to caregivers of people with other chronic diseases, these caregivers have a higher level of unmet needs and burden. more family conflict and personal stress, more serious health problems, lower utilization rates of available services, and shorter life expectancies. Some of the other health concerns include experiences of grief, depression, hopelessness, anxiety, cardiovascular disease, and feelings of being overwhelmed and burnt out. There are a variety of interventions that exist to support caregivers, and they've been developing over the past several years in more numbers now. So part of this increased development can be attributed to the growing awareness of the caregiver role, and this is exemplified in the recognition of the need to support caregivers in the WHO Dementia Action Plan and the National Dementia Strategy in Canada, which both identified supporting caregivers as priority action areas. But as I mentioned, these caregivers still have many unmet needs, so it's really important that we keep working on different programs to support them. So an example of an intervention to support caregivers that has been developing in recent years in this context is navigation. And I know that that's been used in cancer a lot, and so it's sort of newer to the dementia context. So each navigation program looks a little bit different, but they have similar general approaches. So most of the programs focus on supporting the person living with dementia directly rather than the caregiver. The people that are providing support often are actually employees rather than volunteers. So in many cases, they may be working with a multitude of clients in a full-time role. And some of the findings from these programs have suggested that even though the primary focus might not be on the caregiver in the form of them getting services directly, the navigators did find themselves supporting caregivers a lot and attributed a lot of the success of the interventions to them doing the work with the caregivers. So that's a really promising finding for the model that we're using in this research, because we're providing that support directly to the caregiver. Through the programs, they've learned that navigation should provide emotional support, coordination with primary care providers, and should be able to tailor education and resources to the caregivers and the people living with dementia's unique needs. And on the slide here, I have care dyads. And so I'll mention the care dyad throughout this presentation. And what that's really referring to is the caregiver and the person living with dementia as one connected unit. So it's a really common way that the caregiver and the person living with dementia are referred to in the literature and in this sort of area. So some of the impacts of the programs have been improvements in behaviors and decreased healthcare utilization of the person living with dementia. And caregivers have also benefited, which is reflected in the experience of improved caregiver burden, which is great. So that brings us to step 2, so developing the training curriculum for volunteer navigators. So as part of the literature review, we took an in-depth look at caregivers' needs and existing programs, and that information was used to inform the development of the questionnaires for this. So for example, needs that were highlighted in the literature were included as topics within these questionnaires. So this section will indirectly sort of shed some light on more of the literature review findings. So in order to develop the training curriculum for volunteers, we needed to build on our understanding from the literature review to really know what the needs of caregivers are and what knowledge, skills, and abilities, or in other words, the competencies are that volunteer navigators need to be trained in order to meet those needs. So we used an E-Delphi method, which is just a fancy way of referring to a method that's used quite frequently in consensus building. So what it consists of basically are sequential questionnaires that build upon one another, and they're administered to an expert panel. So because the questionnaires build on one another, the data analysis really happens as you go after each questionnaire as it informs the next one. So I'll describe each of the questionnaires that we administered and that process in a little bit more detail. So for ours, we administered 3 questionnaires to an expert panel of 35 individuals who had personal experience as caregivers for people living with dementia, or expertise in dementia research or navigation or volunteerism. So the first questionnaire was intended to establish the importance of caregivers' needs. The second questionnaire intended to gain consensus on the knowledge, skills, and abilities required for volunteer navigators to be able to meet those needs, so what they needed to be trained in. And the third questionnaire intended to establish consensus on the appropriateness of each competency statement. So you can kind of see here, we started with looking at what the needs are, then we went to what are the competencies to meet those needs. And then once we established those competencies, we looked at, are these appropriate for the context of this program? So those questionnaires were administered in that order and really built upon one another. And they informed each questionnaire that came following. So based on responses from the questionnaires, we determined the final needs that should be prioritized to address within the program. The list on the slide here is the groupings of the needs that the categories that the needs were grouped within. So we have the groupings of connecting through supportive relationships, physical and emotional health needs, practical help, finding and gaining access to care resources, information, and healthcare support. And so as you can imagine, there were several specific needs within each grouping that we were looking at. And then we also did that for final competencies that should be included in the training for the volunteer navigators. So the list of 7 items here reflects the categories that competencies were organized within, just like the needs. So we have competencies that were related to volunteer relational skills, supporting caregiver well-being, supporting the care dyad, identifying and assisting with accessing healthcare services, knowledge of dementia stigma, and support for volunteers' own well-being. And based on all this information, and in order to determine what needed to be included in the volunteer navigator training, we did a mapping exercise where we looked at the existing Nav-CARE training and the needs and competencies developed from this questionnaire process. And we determined where there was overlap, what needed to be added, what language might need to be changed to fit the dementia context, and what content might need to be excluded. And from that exercise, we developed 3 key modules that were dementia specific and needed to be included in the volunteer training, in addition to that existing Nav-CARE training. And so those were communication, navigational support, and quality of life. So for the communication module, we developed these 3 learning objectives. And you can see here, there's a focus on supporting the dyad by getting to understand what really works well for them and what best practices for communication may be. For the navigational support module, it's really focused on identifying and accessing resources that are specific to the needs of the caregiver and really the dyad. So this required an understanding of what they need, what they may require encouragement to try and access different resources, and how to actually approach encouraging them. And for quality of life, the module has 1 distinct learning objective, and that's focused on understanding what kinds of concerns caregivers may have throughout their caregiving journey. So this is focused on ensuring volunteers understand that caregivers may be experiencing ongoing grief, loss, anxiety, isolation, and other challenges that impact their overall well-being. So knowing this can really help volunteers to identify when it's happening and develop strategies to support them. So taking all of that information, we developed a dementia-specific training manual that used these modules and learning objectives, and that's what we went on to use for the volunteer training in the pilot. And so that brings us to the pilot, where we took all this knowledge and put it to the test. So a bit of information on what the pilot was all about. So we began the pilot study in September of 2022, and it went until around March of 2023. And we started by partnering with the Hospice Society of Camrose and District in Camrose, Alberta. And that location was selected because they already have the existing Nav-CARE program running at their hospice, and the volunteer coordinator was able to take on the project. The volunteer coordinator there was amazing and helped a lot with the recruitment of the volunteers and the caregivers and dealing with some of the day-to-day administration of the program and the research there. So in September, after recruitment was completed, some of the Nav-CARE team went to Camrose and hosted the training. And that took place for 3 hours one afternoon and focused on content from each of the modules. And it's important to note too that all of the volunteers who took that training had completed the original Nav-CARE training before doing this dementia specific module. And so it was really building on their existing knowledge. In some cases, they had just taken that. And in other cases, the volunteers were already working as volunteer navigators for the existing Nav-CARE program. So they were familiar with the general program. So once the volunteers were trained, they were matched with caregivers and they began engaging in visits. And so visits took place over 6 months for 1 to 2 hours every other week or so was the ideal amount. And throughout the 6-month period, myself and the volunteer coordinator in Camrose hosted a monthly drop-in meeting for the volunteer navigators. And it was a combination of in-person and Zoom. And so the meeting was really there to provide a space for volunteers to ask questions and get support, debrief about their experiences, and really establish a sense of community for volunteers within the program. And in those meetings, I saw a lot of peer support, resource sharing, and problem solving. So when some volunteers were looking for a specific support and didn't know that the community may have had it, oftentimes another volunteer had already been in contact with that and was able to connect them. So it was really a really valuable component of the project. And of course, in piloting the program, we wanted to assess the success of it. And really what we wanted to know about was the implementation, the practicality, and the acceptability of the program. And these components were really important to understand so that we could adjust the program accordingly and make sure that it's really supporting caregivers and will be beneficial in future implementation. So the main component of the pilot is really the biweekly visits, and it's important to know what the goals of these visits are. So overall, it's to develop a meaningful relationship between the caregiver and volunteers so that they're able to understand caregivers' needs and the dyad's needs and understand how best to support them based on their personalities, unique circumstances, and other factors. So it's really a personal and intimate relationship that can be the foundation to success and result in engagement and access to support. The visits also sort of serve as a resource in and of themselves because the caregivers have someone to confide in and are able to talk to someone outside of the regular networks. So the pilot was evaluated using a few different forms of data collection. So we used volunteer navigator visit notes, a midpoint questionnaire that was administered to volunteer navigators, and semi-structured interviews at midpoint and endpoint with both caregivers and volunteer navigators. So the visit notes were templated documents where volunteers recorded information that related to their visits. So they were asked to take these notes after each visit, and there were a variety of information on the notes, such as the format of the visit. So if it took place in person or over the phone, who was present, what kinds of topics were discussed, what support they provided, different challenges they encountered. And that was really a good way to capture information that may be forgotten over time. And it also helped to inform some of the topics brought up in interviews as I reviewed these on an ongoing basis and then was able to kind of dig deeper into some of the things that may have been noted in those interviews. And so I analyzed the data from this using content analysis and a bit of descriptive statistics. Volunteer navigators also completed a midpoint questionnaire that collected demographic information and examined how the visits were going, their confidence level in providing different services, and some of the challenges they may have been facing. And this was also helpful to inform topics in endpoint interviews as well. And so I used descriptive statistics to analyze this data. And for the interviews, as I mentioned, these were completed with both caregivers and volunteer navigators at midpoint and endpoint. And in them, I was really trying to understand what kinds of supports volunteer navigators were providing, the impacts of this support, what caregivers really wanted, and the different ways that we could improve the program. And I used thematic analysis to analyze that data. And so this brings us to the most exciting part, which is the findings. So I'll start with just providing a bit of demographic information on the volunteers who participated in the study. And this information was collected in the midpoint questionnaire. So most of the volunteer navigators were 65 or older. And the volunteer, we had quite a few more female volunteers than male. And lots of them had different work statuses. So most were retired, some were employed or volunteering part-time, and a few were still working full-time jobs. It's also helpful to note the demographics of the caregiver participants. So I didn't get caregivers to complete a questionnaire. I just didn't want to overburden them with research requests. So I collected this information during the consent process, initial discussions with caregivers, and through interviews throughout the study. So the caregivers had a variety of different relationships to the people living with dementia that they were supporting. So most were spouses, some were children, and then there were a few that were friends or siblings. Almost all of the caregivers were female. We only had one male caregiver participate. And the caregivers had a variety of unique circumstances. So a few caregivers were supporting people who had early onset dementia, and these individuals were a bit younger than the rest of the group. In a few cases, also, the caregiver was supporting both of their parents who had dementia, or declining cognition that required them both to need some level of assistance. The people living with dementia also were in a variety of housing situations. So some were living in the community alone, some were living with the caregiver, and others in long-term care or assisted living. And throughout the study, some of those living situations changed as their disease progressed or as other factors changed. And finally, throughout the study, we unfortunately had 2 people who were living with dementia pass away. So now that we have some context to who was involved in the project, I'll go through some of the findings from each of the tools of data collection. And I'll just start with the volunteer navigator visit notes. So there was a ton of information from these, but I'll just highlight sort of the key things that we need to know for all of this to make sense. So most of the visits took place in person, and some other visits were over the phone. That was often when there was bad weather that prevented people from being able to get to one another, or if there were scheduling conflicts. So the majority of visits were between the caregiver and the volunteer navigator with no others present, but some of the visits took place with the person living with dementia there too. In one situation, actually, the person living with dementia, the volunteer navigator, and the volunteer navigator's spouse all visited. And that was arranged by the caregiver and volunteer navigator as a way to help support the person living with dementia while also allowing the caregiver to talk freely with the volunteer. In another case, the volunteer attended a geriatric assessment as a support to the caregiver. So the visit was in the presence of a healthcare team, and this happened at the request of the caregiver who wanted that volunteer there as a support person for them. In terms of facilitators and barriers, many volunteers felt that caregivers' openness to communicate was a facilitator for their visits. They also found that caregivers' distress was a challenge, as it often prevented them from being able to discuss their own needs, and instead focus was placed on the person living with dementia. Volunteer navigators also learned a lot through these visits, and some of the learning they highlighted was the importance of listening. And they found that this was a huge component of the service they provided. They also learned more about the different physical and emotional needs of caregivers. And through this learning, they found that trying to focus on the positives, talk issues through, and encourage caregivers to set boundaries was really valuable learning and how to provide effective support. So for the questionnaire, again, there was lots of information, but I've just pulled out a few key points. It provided a really good perspective of the volunteer navigators sort of perspective midway through the research. So most volunteer navigators felt they were able to provide navigation services without difficulty and were generally satisfied with their role. Most volunteer navigators also felt their efforts contributed to the well-being of the caregivers, and some also felt that this impacted the person living with dementia. A few other findings to highlight were that a small portion of volunteer navigators reported not feeling confident in being able to identify gaps in available resources and navigate alternative options. And 22.53% of volunteer navigators weren't confident that they could identify community and online support services and assist caregivers to access them. And so even though those percentages seem relatively small, it's really important to note because we want all the volunteer navigators to have confidence in their ability to provide these sorts of navigation supports. So it gives us a good indication of where we need to make some adjustments. And finally, the vast majority of volunteers felt they understood keywords and definitions that are relevant to dementia and caregiving. And this knowledge of dementia response is particularly interesting when you look at it in comparison to some of the interview findings regarding the need for increased knowledge of dementia and caregiving. And I'll discuss that in a couple slides. So on to the interviews. So based on the interview data and thematic analysis, I developed 9 themes, and these were there were some overlapping perspectives among caregivers and volunteer navigators, and some perspectives that were unique to each group. So I'll try to do my best to speak to how each theme is informed and where that is coming from, which group. So the first 2 themes speak to the kinds of supports that volunteer navigators provided to caregivers. So both caregivers and volunteer navigators recognized that through this program, volunteers provided support in 2 key areas, which were emotional and relational support and healthcare and legal system navigation support. The third theme is about the knowledge of dementia and caregiving, and that volunteer navigators really need to have that knowledge to be able to support the dyad. So both caregivers and volunteer navigators emphasized the importance of that knowledge and that it was really foundational for volunteer navigators to be able to support caregivers. And both groups also highlighted how volunteer navigators maybe lacked a little bit of this deep understanding and that it reduced their ability to adequately support caregivers. The fourth speaks to the ways caregivers and people living with dementia are interconnected. So in interviews, caregivers really spoke about the ways that they were connected to people living with dementia, both implicitly and explicitly. So volunteers learned about the interconnectedness of caregivers and people living with dementia and what really that means in terms of providing navigational support to them. The fifth theme is about the importance of relationships. So it really came through in the data with volunteer navigators as the backbone to the support. So having those strong relationships with caregivers allowed volunteers to provide support and have caregivers share with them. And developing those relationships was noted as one of the most meaningful and important benefits that came out of being involved in the project for volunteer navigators. So it really served as a benefit in lots of ways to caregivers, but also was really noted as a benefit to volunteer navigators. The next theme, listening is a double-edged sword, is a really interesting theme to me. Volunteer navigators provided listening as a service was actually quite a polarizing topic for caregivers, and I will get into this in a bit more detail shortly. The seventh theme discusses the value caregivers placed on having longitudinal, individualized, and adaptive support. So caregivers highlighted the value of having a volunteer navigator by describing how important these components of support are. So this really emphasized some of the key factors that we need to consider in future implementation, which is making sure that we structure the program so caregivers can be set up with volunteer navigators as early in the caregiving journey as possible. The eighth theme highlights that caregivers are taking care of themselves. And this was really quite a positive theme because it focuses on describing how caregivers are engaging in self-care and are able to be positive in their situations despite some of the challenges that they're facing. So for example, caregivers were talking about how they go to movies, they get massages, they go for motorcycle rides and visit with friends. And I think it's really important to note because we often talk about caregivers and caregiving by focusing on the challenges they face and the sadness of the scenarios. But all of that's important, all of that's true. But I also think it's important to highlight their resilience and independence that they're demonstrating here. And the last theme is about some of the program level and system level considerations that impact providing dementia navigation services and should be thought about in future program implementation. And that's really connected to the ways that volunteer navigators could provide better support. And it's related to a lot of the logistic components, like ensuring volunteer navigators have good availability and don't cancel visits, and that volunteer navigators and caregivers are well matched based on some of their similar interests or life experiences or personality factors. So I'm going to go into more depth on a few of the themes. I'd love to go over all of them in depth, but because of time, I'll just select some of the ones that I think are really important to give some more discussion time to today. So the first theme is volunteer navigators providing emotional and relational support. And I selected 2 illustrative quotes from the data to help outline the meaning of this theme, and those are the ones that are on the slide here. They're both from volunteer navigators as well. So the theme is really exploring the key focuses of emotional and relational support volunteer navigators provided to caregivers, how that support was provided, and the impact it had on caregivers. So emotional and relational support often addressed grief, family dynamics, and frustrations with the healthcare system. And caregivers really highlighted that they felt most supported in dealing with the anticipatory grief and ongoing grief in particular. It was really great having this support because it was able to be individualized, and caregivers often felt that they could lead the discussions by talking about topics that were important to them. And so by providing the support, volunteers were intending to address caregivers' isolation and loneliness, really encourage them and validate their emotions and decision-making specifically. In many cases, volunteer navigators viewed this support as being the biggest contribution they could make. And sometimes that was perceived as they were providing enough support, and in other times they were questioning whether they could be doing more. So as a result of the emotional and relational support that was provided, caregivers noted that they were able to reflect in ways they were previously unable to, because they felt less alone, and they were able to tell their whole story of caregiving, sometimes for the first time. And they were provided with insight and perspectives that challenged their perceptions of their own circumstances. And as a result of that, they recognized that through this, they had increased feelings of peace, hope, less guilt about their decision-making, and they felt more empowered and able to recognize some of their own needs. The next theme is volunteer navigators provide healthcare and legal system navigation support. So generally, healthcare and legal system navigation support was provided less frequently than emotional and relational support. The type of navigation support provided varied, and it included volunteer navigators talking directly to home care managers, attending doctor's appointments with caregivers, conducting research to understand the healthcare and legal systems relating to dementia, and encouraging and following up with caregivers to access resources and contact providers. And caregivers really highlighted that volunteers connected them to existing resources in their community by reminding them or informing them of services and encouraging them to access them. And what was really important was that following up to see if they did access them. And so that was noted as something that was really quite beneficial. The caregivers also noted the resources that they found most beneficial, and that was focused on grief coping tools, guiding documents for visits with the person living with dementia. And what came up quite a lot was tools to explain the power of attorney and personal directive processes. But they also did note their desire for more support with resources, and that was particularly relating to assisting with house maintenance and paperwork at various stages of the dementia journey. So for one of the examples was what happens in terms of paperwork for from placement to passing for that person living with dementia. And the motivation for volunteers to provide the support was to make the caregiver feel less alone and more supported, and also to help caregivers achieve their specific service-related outcomes, which was sometimes resolving a legal issue or understanding the system to make informed decisions. So there was that emotional underlying component to this as well. So volunteer navigators felt that it was an important support, but that their impact was limited because caregivers didn't always act on the information that was provided to them. And volunteers also really wanted to have a better understanding of how these things work. In cases where caregivers did not access services, volunteer navigators really wanted to learn more about how they could encourage them to do so in the future. And so to me, this theme really highlights the importance of receiving personalized guidance to access dementia related resources, and those that meet the individual needs at different stages of the caregiving journey, because those different services that they required were so different throughout the months of the study, let alone the whole overarching journey of caregiving. So a deep understanding of dementia and caregiving is needed to support the dyad. And this theme really explores volunteer navigators' desires for increased knowledge of dementia and the motivations for and importance of that increased knowledge. So volunteer navigators wanted more information on a few topics. So they wanted more information on dementia, particularly different forms of dementia, the disease trajectories, approaches to engaging with people living with dementia and managing symptoms of the person living with dementia, and community-specific resources. So they wanted a centralized and streamlined, accessible format for that. They also wanted to understand the healthcare system more, so understanding different levels of care, how to complete paperwork and apply for supports, and also generally the caregiving experience. In some cases, they really wanted this knowledge to be able to educate caregivers, but in a lot of it, they wanted this knowledge so that they could provide reassurance to the caregivers and help them with problem solving. Caregivers wanted volunteer navigators to have this knowledge, and they had a couple different areas where they wanted caregivers to be more informed in, and that was to have strategies to engage people living with dementia as the disease progresses, best practices for communicating with the person living with dementia, different medications, financial supports, community resources, and the unpredictable disease trajectory. They also wanted improved knowledge of the caregiving experience specifically, and that was relating to family dynamics, grief, and navigating the legal and healthcare systems. The slide is still talking about the dementia knowledge. It's just giving 2 quotes from caregivers instead, so you can see a little bit of their perspective. So caregivers wanted volunteer navigators to have that knowledge for a variety of personal and practical reasons. So in some cases, it was that they wanted the volunteers to be able to empathize, validate, and listen to them, and just be there for them. But in others, caregivers really wanted volunteer navigators to have this knowledge to streamline information and provide really tangible, practical tips that they could act on. The consequence of this lack of knowledge was really felt by both caregivers and volunteers. And volunteer navigators had confusion regarding the scope of their role, as they felt limited in their ability to provide support. And caregivers, this ended up being that they had some skepticism of the volunteers' ability to adequately support them. So in some cases, this was quite notable, as caregivers felt they were educating volunteer navigators rather than receiving support. And that's reflected on that top quote on the slide here. So both caregivers and volunteers really were aware of the importance of having this really thorough knowledge. But some caregivers indicated that even if volunteers had that increased knowledge, it wouldn't enhance their ability to support them, as a lot of the barriers to feeling supported were more system level issues that still impacted the program. And so thinking back to the questionnaire response, where many volunteer navigators said they were confident in their ability to understand keywords and definitions relevant to dementia and caregiving, I think this data really demonstrates how the knowledge that is actually useful in this role is deeper and more nuanced than those keywords, and we need to be assessing knowledge in a little bit of a different way. The interconnectedness of caregivers and people living with dementia is another important theme to discuss. So caregivers really discuss this interconnectedness by diverting conversations to focus on the person living with dementia rather than themselves, and by directly discussing the importance of the needs of the person living with dementia over their own. In a few cases, caregivers explicitly recognize this interconnectedness because they described how their mental and physical health was directly impacted by the health of the person living with dementia. It was also evident in discussions where caregivers struggled to articulate their own needs. So, for example, if they were asked directly about their personal needs, they often diverted the conversation to then discuss the needs of the person living with dementia instead. Volunteer navigators saw this as well. They explained that during visits, caregivers often focused discussions on the needs of the person living with dementia. So for example, caregivers were concerned about being separated if the person living with dementia required more support and the quality of care the person living with dementia had. In some cases, caregivers did identify their own needs, and when this happened, they were often mentioned in relation to the needs of the person living with dementia. So in conversations about self-care, caregivers said that they recognized it was important to do self-care, but it was to keep supporting the person living with dementia rather than to meet their own needs. They sometimes even noted that they wanted the volunteer to support the person living with dementia directly rather than themselves. But when they talked about respite, it was a little bit different, and caregivers were able to recognize the importance of having a break, which would allow them to address their own needs. So it varied a little bit, but was very much focused on that person with dementia. So through those discussions, volunteers developed an understanding of the necessity to provide support that addresses both the caregiver and the person living with dementia. And the last one is listening is a double-edged sword. As I mentioned, it's really important to note this theme as it highlights a lot of that polarization. So there were opposing views among caregivers regarding the value of listening as a support provided by volunteer navigators. So primarily, caregivers found this to be really beneficial or an insufficient support. Caregivers who found listening to be beneficial described that volunteer navigators were objective people that allowed them to vent, focus on their needs, helped them process their emotions, followed up on discussion topics, and made them feel less alone. But caregivers who found listening to be insufficient described it as the same support that a friend could offer. And so I think it's an important aspect of this that really highlights the importance of a deep understanding of dementia again. And that is, some caregivers have highlighted that volunteers didn't know enough about dementia to provide meaningful support through these conversations. So in those cases where it wasn't valued as much, there's still potential to make this a more valuable support by adjusting some of the curriculum and approaches to volunteer navigator training to improve that knowledge and understanding, and really maybe make this a more neutral or more positive service that's provided. So the key takeaways from this: we know generally that Nav-CARE can support caregivers of people living with dementia, but that some changes need to be made to the training and some of the logistics of the program to improve it. So we know that the main supports being provided by volunteer navigators were emotional and relational support and support navigating the healthcare and legal systems. We also know that that knowledge is really essential to have that's more deep and nuanced. We also learned the needs of caregivers and people living with dementia are so interconnected that in order to support caregivers, we really need to address some of the needs of the people living with dementia directly. And when we think back to the training curriculum we developed, we had those 3 distinct modules of communication, navigational support, and quality of life. So looking back at those, with the feedback from this pilot. They still fit, but they just need to be made a bit more specific and detailed. And that will require a bit of a longer training session for volunteers, which is okay because the overwhelming response was that volunteers wanted longer and more in-depth dementia-specific training. So that was really nice to hear. We also learned that having caregivers connected to volunteer navigators at the beginning of the caregiving journey, preferably right from diagnosis, was the best way for caregivers to feel supported. And that's what they really want in order to have someone walk through the journey alongside them. And so we need to look at how communities can make these connections, who's aware of Nav-CARE and who's making those referrals, so these connections can happen early on. And finally, the next steps. So in the next few months, I'm going to get together the participants from this study and present to them what all of their contributions made to this work. They were really quite interested in seeing where this research went and what the impact would be. So that's really important to me to do over the next little bit here. I'll be working on publishing the second phase of the research, so the pilot study. The first phase is published in Dementia already, and if anyone's interested in reading that, I'm happy to send a copy over and connect you to that. As I discussed, we'll also be going back to the drawing board with the volunteer curriculum to make some changes and integrate this feedback. And then, of course, on the personal side of things, finish writing the last portion of my dissertation and complete my PhD this summer. So thank you, everyone. And I did just want to say a special thank you to Joy LeBlanc, who was the volunteer coordinator at our pilot site. And she passed away during this research. And everyone who met her, all the caregivers, all the volunteers had just felt that she was an incredible support to their community. And working with her really demonstrated to me the importance of having strong community leaders. And without her, this program would have been really challenging, and the research. So I just wanted to make sure she was honored that way. Thank you.
Thanks, Madison. That was amazing. What great work you've done there.
Thanks.
I've just been busy writing away, and I have questions and all that, and lots to chat, but I'm just aware of the time. So you mentioned earlier on connecting with the caregiver dyad, what needs to be prioritized. I'm curious, did you think about how early is early?
Yeah, so once that started coming up, I tried to ask caregivers a little bit more about what that actually meant, and what a lot of the people who were early or who were later in the dementia caregiving journey said was that this type of support was valuable now, but had they had it right from diagnosis. So if the physician, for example, could have been able to say, here's the dementia diagnosis, and we have this volunteer navigation program that we're going to connect you to right away, and that volunteer could have ridden the journey with them, that is the support that they want, ideally. So they thought that had that relationship been established really earlier on, and they had some support to navigate setting up all of the supports that they sometimes had in place at this stage, that would have been really where this made the most impact.
Okay, so right away, that's a pretty significant suggestion.
Mm-hmm.
Yeah.
Yeah.
Yeah, wow. And I would agree. There's a question in the chat, and it had to do with confidence and abilities. So this is from Lori. Were the navigators who did not feel confident in their ability to identify resources able to bring these concerns to the monthly meetings?
Yeah, so the volunteer navigators throughout the study and at the end said that those monthly meetings were absolutely crucial to the program to be able to address some of those issues that they felt. So in those sessions, they were able to share resources and come up with different solutions to things by relying on one another. And I think a lot of the time, some of those programs are we want them in a consolidated list online that we can look at, but a lot of it ends up being word of mouth. And so I saw that firsthand in the volunteers being able to share what resources they were using. So that really helped to improve connecting people and problem solving.
And that's what we've seen, just so everybody knows, at North Okanagan Hospice, we've had the pleasure of having Nav-CARE going here for over 5 years. And there's such a richness and sharing and a lot of support for the navigators during those monthly meetings.
Yeah.
Just another question from Barb. Thank you for that excellent presentations. Do you have any ideas for how we can better involve persons living with dementia?
Yeah, so I think that's one of the challenges, because some of what ended up happening is when those visits took place with the volunteer, the caregiver, and the person with dementia there, conversations were changed, or they were limited, or some of the focus was diverted from the caregiver to the person living with dementia. So I'm not sure what it will look like, but there has been discussion of other programs where they use 2 volunteers. So they have someone that can hang out with that person with dementia, go do an activity with them, and then the other person can support the caregiver. But I think, so that's one idea, but I also think there's, it goes back to that education of dementia and caregiving, and really having an understanding of what the system will look like, what those caregivers need, because I think what this role can be really pivotal in is helping with those specific dementia related tasks that they don't have access to support elsewhere. And then they can take care of some of the personal side of things because that time is freed up. So I think it goes back to really improving that education.
Yeah. Awesome. Thank you for that. Now, in these sessions, we often have caregivers jump in, and I just so appreciate it. So we've got a comment from Stuart, who's a caregiver. I think the hour I just wasted listening to this would have been better spent taking my dear wife for a walk. Better yet, having an hour respite from interior health. Evidently, we no longer qualify for that support. Thank you, Stuart, for sharing this with us. This is all about supporting caregivers. And what I'm hearing right now is that, yes, there's many system level challenges with supporting caregivers for folks with dementia. And our heart goes out to you. And our hope is that with this Nav-CARE adaptation is that we can help prevent things like this happening, so that people can have support for navigating, finding the support they need early on. So I do thank you, Stephen, for sharing that. It's so important, this caregiver perspective, in whatever form it looks like. This is who we're serving. Yeah. It's these unsung heroes of our society. Just one more question. We're at 10:59 and we want to, sorry, Jennifer, you're giving me the 1 minute. Does Madison have a date when the dementia module will be available in the curriculum?
It will be sometime over this next year. I think in the fall is when they anticipate having that, but I don't have a firm date at this point.
Okay, thank you. And there's some great comments in there. I'm going to turn it over to you, Jennifer.
Thanks, Clara, and thank you and the North Okanagan Hospice Society for partnering in this event. And Madison, thank you for sharing your research and the processes that you've gone through. The needs and supports for dementia and caregivers is as we've heard, so necessary and so needed. So thank you for sharing your results with us. And good luck in the next few weeks as you progress towards defense. And congratulations on your work so far.
Thank you.
With respect to today, thank you for joining us, everyone. We encourage you to attend other events scheduled for Embrace Aging. Please visit our website at OkanaganEmbraceAging.com for more events and registration. We look forward to growing this event, and if you have suggestions for future events, please don't hesitate to contact us. Lastly, you will receive an email with the link to an online evaluation form. We welcome your feedback and suggestions for planning Embrace Aging in the future. I do hope my mic is not failing, and with the Tuesday trying element of my microphone, I would like to thank you everyone again and have a splendid remainder of the day. It looks like it's beautiful here in the Okanagan, so wherever you are, take some time for yourself and have a great day. Thank you. Bye now.